Hi everyone, this is Srividya and welcome to my channel on Cardiac Essentials. Today we'll be talking on aphasia. So it's also called dysphagia. So what is this condition? Like yesterday evening while watching television, one of my patient called and she said like she's not able to speak. Suddenly there is a speech loss, which resumes like after few minutes. And so like coming back on to aphasia, what is this? This is a condition which makes the patient difficult to communicate. So which makes the patient finds it very hard to speak, read, write and understand others. So you might be wondering what is causing this aphasia or dysphagia. So basically this is caused by a stroke or brain injury. There's no cure, but we doctors try to bring in some improvement with treatments. So basically when you talk about aphasia, it's problem with communication, including speaking, understanding others, reading and writing. So patients get affected in different way, and the symptoms are not able to say the right words or speak very slowly with long pauses and finds it very difficult to speak. They speak in a very short or incomplete sentence, or sometimes they keep repeating, mixing up or missing out words. So the other symptom is like making up words or sounds, and some patients are not able to understand what other people are talking, particularly if they are not able to see them. Say there is a phonic conversation, they don't understand what the other person is talking, and sometimes it is a result of difficulty reading or writing. So aphasia is caused by damage to the parts of the brain that deal with language. So you might be wondering what causes this aphasia. It's a stroke. This is the common cause of aphasia. It can be heart related or severe head injury. Sometimes it can be a car accident, or somebody might trip over at home itself, or while traveling they might get hit on the railers. So there are different things that can cause a severe head injury, and patients may think that okay, now I'm doing well, why not? They try to ignore the symptoms and walk, which is not good. So even if it is a little symptom of not remembering things or little symptom of not able to speak, they have to consult a primary care physician initially. Try to get the lab work done. So when I talk about the lab work, I talk about the ECG echo, because it can be related to heart failure and also like CT or MRI scan of the brain, and also other conditions that cause the brain. Sometimes what happens is it might be a result of a brain tumor or a bleeding or infection in the brain. And the other reasons might be the brain is that causes the brain to become damaged over time, like dementia. Dementia where people they tend to forget, or alcohol or drug related damage. Or you might be wondering, but sometimes a drug allergy can also lead to slurring of speech or speech loss. Every drug, any drug, even to any drug, because the physiology from patient to patient differs, and mostly it's very common in people over 65, because they are more exposed to risk of stroke, and conditions like dementia is higher in older people. So there are different types of aphasia, in which part of the brain it is associated with. So you have to understand what causes like aphasia. Like I said, it might be the brain injury that will be primarily, or it can be related to the heart. Aphasia can also result from heart problems. So when you are talking about heart, when I am talking about heart, it is primarily when a stroke is caused by a cardiovascular issue, such as cardioembolic stroke. So what is cardioembolic stroke? So wherein a blood clot from the heart traveling to the brain, which involves a blood clot traveling from the heart to the brain. So, and other things are like heart failure itself may also increase the risk of aphasia. By what happens is there is a reduction in the brain blood flow, which causes like cognitive changes. It's less common than stroke-related aphasia. So we have to be more careful. One has to be more careful about managing heart health, which is very crucial for aphasia. So preventing by controlling the risk factors like high blood pressure and heart disease, which can eventually lead to strokes. So what is the underlying condition for heart disease is keep yourself relaxed. There are so many day-to-day life, it might be a simple altercation at home, or it might be something in the professional life that can lead to stress in the heart, wherein the heart will lead more effort to pump blood, and which can lead to the thickening of the heart muscles, which can lead to strokes. So the most common cause of aphasia is stroke, which can result from heart issues. So we were talking about cardioembolic stroke. What is that cardioembolic? Cardioembolic stroke is nothing but the blood clots that form in the heart because of conditions like atrial fibrillation, AFib, or patent foramen valve, PFO, can break off, travel to the brain, or cause a stroke or subsequent aphasia. The other heart condition is heart attack, myocardial infarction. So wherein a heart attack can sometimes lead to brain damage. So every organ is interrelated, we cannot say one problem can lead to, yes, you have to be very careful in keeping yourself very healthy. How do we do that? Is please do take the heart medications. The medical practitioners are spending so much of time in studying the entire, the different organs of the body, and the pharmacologists are coming up with good medications. We should take it as a blessing and try to continue the heart medications, or any medication. It can be thyroid, heart, it can be, lung, liver, anything. But take your diabetes, take your medicines in the same time regularly, go for labs, try to keep yourself healthy, Coming back to our subject of aphasia and heart attack. A heart attack can sometimes lead to brain damage, and that can manifest as aphasia or other speech and language problems. So what are the other things like heart failure? What happens in heart failure? Reduced brain perfusion in heart failure. What happens? Heart failure can decrease the amount of blood and oxygen reaching the brain. That's called as cerebral hypoperfusion, where there is lack of blood flow in the brain that can impair brain function and contribute to cognitive impairment, including aphasia, especially if you take the elderly people. The more stress, more problems. So now you might be asking, how do I manage my heart healthy? How do I keep my heart healthy to prevent aphasia? Good question. So proactively managing cardiovascular risk factors is managing your high blood pressure by not having stress. Do what relaxes you, you know. Everyday activities, every day, whether it is personal, professional life, there is some amount of stress present. But we have to know how to keep ourselves relaxed and handle stress effectively. Again, high cholesterol. Nowadays, if you go to restaurants, you take any spicy food, it has got a lot of, to make it very delicious, they try to add up lot of butter, a lot of, spices, lot of, in some restaurants, they even, we used to call it dalda, like some kind of stuff that they put that's high in cholesterol, that's, and restaurant foods, highly spicy, more of kind of butter and stuff, are not really healthy. You have to have a balance in diet by having fresh fruit salads, fresh vegetable salads, a glass of milk, good exercise. Depending on what kind of ailments you have, how do you do lifestyle modification, what meds to take, one can have a healthy life. So with the time constraint, I am going to end this video here. If you like my videos, please do subscribe to my channel and stay tuned for my further channels on cardiovascular diseases. Okay. Wishing you all a healthy life. God bless. Thank you.